A recent study has revealed that the vagus nerve, which is crucial to the body's rest and digest response, plays a more significant role in heart function during exercise than previously believed. These findings hold potential for the treatment of ailments such as heart failure, which can lead to exercise intolerance. It has conventionally been postulated that, during physical activity, the sympathetic, fight or flight, nervous system primarily regulates cardiac function, whereas the parasympathetic, rest and digest, nervous system solely maintains control over heart rate. Nevertheless, a recent study conducted by researchers at the University of Auckland in New Zealand has effectively debunked this assumption, highlighting the significance of the parasympathetic nervous system. The study reveals that the parasympathetic nervous system deserves greater recognition as it demonstrates an increase in activity during exercise. Rohit Ramchandra, one of the study's corresponding authors, stated, "Our research has employed advanced electrical recording techniques to directly observe the activity of the vagal nerves responsible for the rest and digest response in exercising sheep. Surprisingly, we have observed a notable surge in activity within these vagal nerves that connect to the heart during exercise. The sympathetic and parasympathetic nerves originate from the brain and extend to the heart, thereby regulating the heart's capacity to circulate blood. These nerves are referred to as autonomic due to their operation without conscious cognition, encompassing the vagal nerves, or vagus nerve, responsible for controlling the parasympathetic nervous system. The cardiac vagal nerves intricately innervate the entirety of the heart." The researchers conducted a study utilizing sheep as subjects to investigate the impact of physical exercise on various cardiovascular parameters, such as cardiac vagal nerve activity, heart rate, coronary artery blood flow, and cardiac output, i.e., the volume of blood pumped by the heart within a minute. A specific subgroup of the sheep underwent a surgical procedure to remove the left branch of their cardiac vagal nerve. The researchers conducted a study employing sheep as test subjects in order to examine the effects of physical exercise on diverse cardiovascular parameters, including cardiac vagal nerve activity, heart rate, coronary artery blood flow, and cardiac output, i.e., the amount of blood expelled by the heart per minute. A particular subset of the sheep underwent a surgical intervention to eliminate the left branch of their cardiac vagal nerve. Based on the aforementioned discoveries, the researchers have put forth a new hypothesis, positing that exercise leads to a simultaneous augmentation of both vagal, parasympathetic, and sympathetic nerve activity, resulting in a synergistic effect that promotes the preservation of cardiac function. Subsequently, the researchers delved into the chemical mechanisms underlying the vagal nerve response. Ramchandra expounded on the matter, stating that the cardiac vagus nerve discharges various mediators, with previous studies primarily concentrating on the neurotransmitter acetylcholine, which does not appear to have any bearing on our capacity to engage in physical activity. Due to the researchers' interest in investigating the impact of the vagus nerve on exercise, they proceeded to examine the influence of an additional mediator known as vasoactive intestinal peptide, VIP. Despite its nomenclature containing the term intestinal, VIP is also present within the cardiac system, where it induces expansion of the coronary blood vessels, enhances contractility, and elevates heart rate. Ramchandra stated, "Our study centered on an alternative mediator, namely vasoactive intestinal peptide, VIP, and it demonstrates that the vagus nerve releases this peptide during physical exertion, thereby facilitating the dilation of coronary vessels. Consequently, a greater volume of blood is able to circulate through the heart." The researchers assert that these findings possess potential implications in the realm of disease management, particularly in cases of heart failure, where individuals afflicted with this condition are unable to endure physical activity. Ramchandra stated that a possible explanation for the decrease in exercise tolerance is the insufficient supply of blood to the diseased heart. He further mentioned that our subsequent investigation aims to explore the potential utilization of cardiac vagal nerves in enhancing exercise tolerance among heart failure patients. It is imperative that we engage in physical activity.